We are focusing on Chapter 6 today. Chapter 6 is the humanistic, existential, and solution-focused approaches to psychotherapy. You will utilize quite a bit of solution-focused approaches to psychotherapy since solution-focused is pretty easy to do, and as it implies, it's solution-focused. So pretty easy to do in medication appointments. Looking at the introduction to this, these approaches emphasize holism, self-actualization, facilitate communication, and therapeutic relationship. And so the major humanistic and existential approaches include the following: person-centered therapy, existential psychotherapy, Gestalt therapy. I don't know anybody that does Gestalt therapy. So I won't go through it quite a bit, but Wheeler goes through it. You can read more on that, but I don't know many therapists that do Gestalt therapy. And then emotion-focused therapy, EFT, and then solution-focused therapy. And others include transactional analysis, focusing, actualizing therapy, redecision therapy, and motivational interviewing. You probably learned that in your FMP. And you might have even learned it in your BSN. And we'll talk about motivational interviewing in different chapters because I think it's important to know motivational interviewing. So nursing in the humanistic and existential approach, empathetic attunement and the therapeutic relationship are emphasized in advanced practice psych nursing and other mental health disciplines. So several nursing models and theories have drawn from this approach. Watson's theory of human caring, you've probably all heard of. And then in our undergraduate programs and our FMP, you were probably taught the Abraham Maslow's theory of human needs. And Carl Rogers' facilitative communication techniques. So those are different humanistic and existential approaches. So the roots, you can review this. So Wheeler goes over more of this, so I won't read it to you, but you can pause and read also. And so just knowing that it comes from, you know, a movement following World War II and focusing on kind of the humanism, existentialism, and phenomenology. And then characteristics of this psychotherapy is really the centrality of the therapeutic relationship. That's a big one. Commitment to the perspective and the experience of the patient without prejudgment about what is real or false or what is significant or trivial. All you're looking at is how the patient's viewing it and how you can help them feel better about it. And holism, you know, the person is viewed as a unique individual who can't be reduced to separate parts. And within that, we're focusing on the here and now. The authentic contact and change can only happen in the present, instead of like psychodynamic, where we're focusing on the past and the stages where you're stuck. We're focusing on the human now. Emphasis of different themes. Different universal human experiences of life are explored, including awareness, authenticity, freedom, choice, responsibility, meaning, and self-actualization. You want to get them to where they can be the best that they can be. And the process, the flow of action and reaction within a session rather than its contents, is the focus of the therapy. So attention to process includes pacing, timing, and tracking, so close observation and following the process. And then use experiential techniques. So I'll let you kind of look this over. Some techniques are attention to the body, the breath and voice, exaggeration to emphasize awareness, reenactments of problematic scenes of the past to create healing moments in the here and now, use of creative arts like drawing, music, movement, dream work, or the empty chair. Dream work's an interesting one, and Wheeler goes over quite a bit of this, so I won't focus too much on it. And person-centered psychotherapy was developed by Carl Rogers, and I think what you really need to take out of this is that it's that unconditional positive regard to the patient. Just unconditional positive regard, regardless of what happened, what they're talking about, your unconditional positive regard to the patient, empathetic understanding, and congruence. So really what you can take out of all of this in terms of person-centered therapy is that unconditional positive regard, that empathetic understanding, and congruence. So really take that home and understand that when we're thinking about person-centered therapy. So key concepts, the belief in a positive human nature, self-concept, actualizing tendency. You want them to get to the top of Maslow's hierarchy, a fully functioning person. You want to integrate their self-image, their sense of worth, and their ideal self. You want them fully functioning and self-actualizing. You want them to live authentically and cope well with problems. And you as the therapist provide a climate that's conducive to helping the person achieve these goals. And so you can read through this too. And definitely, I know it's a lot of reading with Wheeler, but it's good reading. It's fast reading. It's not hard reading. It's eye-opening reading. And it really is reading that you can use. And so it's definitely worth reading Wheeler. So this is therapy. And again, us in medication management don't really have the ability to do this. But in terms of that person-centered therapy, the therapist initiates the assessment by asking the patient where to begin. So it's really up to the patient where they want to start and their experience. And the diagnosis with person-centered therapy is not really highly regarded. So it's really about the person and the feeling and the emotions and helping them work through that to get to where they need to be. And I like how this says the therapist creates an understanding atmosphere that encourages clarification and reflection of present feelings. Really kind of repeating back to them that you're hearing them and understanding them. The difference with person-centered psychotherapy compared to like a cognitive behavioral therapy is really each session is considered fresh and unpredictable. Some of these other therapies, especially dialectic behavioral therapy and those CBT therapies, are very structured. And they have like session 1, you do this, session 2, you do this. This one's just fresh and unpredictable. You don't know what the patient's going to bring up and you just kind of go with it. Key concepts of presence, just being completely attentive to and immersed in the patient's expressed concerns and addressing what is going on between the patient and therapist. So you can practice some person-centered psychotherapy when you're actively listening to a patient who's struggling with something. You can be there, fully present and unconditional. But in terms of the time to be able to do that often is within medication management just difficult to do. And again, I want to just focus on these core things, the congruence, having inner and outer experiences that match, unconditional positive regard, a deep caring for the patient that is best achieved through empathetic identification, an accurate empathetic understanding, a deep understanding of the patient that requires attunement to the patient's experience and it's revealed moment to moment. So really those are the core to that person-centered psychotherapy technique. Just being there for the patient. You know, sometimes all that the patient needs is somebody to be there for them. Gestalt therapy, I'll kind of whiz through this because I don't know many Gestalt therapists, and Wheeler goes over it. So Gestalt is meaning the organized whole. Theoretical roots of Gestalt therapy, you can go through that. So looking at that, the concepts of figure and ground, so foreground and background, are key to the theoretical explanation for how the self develops and organizes experiences as it interacts with the environment. So really all behavior is organized around emerging needs and their satisfaction. So key concepts of this Gestalt psychotherapy is that the awareness of sensation, the figure and ground formation, mobilization, action, contact, and withdrawal. So that cycle to really understand where the dysfunction and help guide the therapeutic process and intervention. Layers of the personality during therapy, specific interventions by the therapist help the patient move through the layers of the personality to contact their authentic self. So really, in terms of Gestalt, is finding that who you are, your authentic self. And sometimes within those layers, you have not fully formed selves, and that it can be difficult to know who you really are. They're inauthentic layers of the personality. So interruptions to awareness and contact or boundary disturbances refer to dysfunctional processes developed early in life that people use in an attempt to meet their needs. So introjection, projection, retroflexion. And also confluence. Deflection is a big one. I see a lot of deflection with avoiding direct eye contact, overuse of humor, generalizations. And you will see this. I can see where Gestalt therapy came, and you will see this within appointments. And the goal is to assist the patient in restoring his or her natural state of self-regulation. So looking at this, the assessment occurs during the initial session and is ongoing throughout the course of therapy. It is individualized and collaborative, addressing both process and content factors. So looking at that, you can review that, and Wheeler also goes over that too. The assessment strives to understand the patient's experience and recognize factors that hinder their self-regulation. And you want to work collaboratively with the patient to come to a shared understanding of what's important and to explore. So Gestalt therapists are interested in what is emerging in the moment and in making the past, present, and future come alive in the here and now. So they have critical therapeutic skills to establish an authentic I-thou relationship and to craft creative experiments. So you can review that. So body awareness is important. Focusing and dream work. So another one that uses dreams. So with Gestalt, characters and objects in the patient's dreams are viewed as projections of disowned parts of self and need to be reintegrated. So dream work's interesting within it, keeping a dream journal. I think dreams are interesting for sure. Empty chair dialogue. This, I've used this. So a person who is unable to express his or her feelings to another person is asked to put that person in an empty chair and tell him or her what needs to be expressed. I've used that before, or journaling and then rip up the letter. things like that. Language of responsibility, focus on deflected language that the patient may use to decrease the intensity of awareness and contact. And then existential psychotherapy, a philosophical approach to psychotherapy, addresses the large universal themes of life and attempts to resolve them. And so, especially when you have somebody, like we talked about Eric's stages of development, you have somebody who is really in that older age and is struggling with despair and isolation, really utilizing some existential psychotherapy to really look at that bigger picture. So some key concepts are these: choice, freedom, responsibility, awareness, aloneness, meaning, some anxiety with it, some death and awe. So I like this type of therapy. I've used this type of therapy in terms of facing the anxieties of life. You know, freely choose their life direction. Where do I go now? I have to make a decision, especially if people really do not like their job and they want to be medicated to deal with their job. I just had one that was in a crisis in my appointment due to something that happened at work. And I said, you're just going to have to get a different job. You know, we can't just keep doing this. You know, you have free choice for your direction of life, and you can choose to continue to live like this and be in crisis, or you can choose to change it. And so, looking at that, you know, they have the choice for their life direction. You're not stuck where you are. You have the choice to move and to take responsibility for their choice. You know, you choose to go back to that job. You choose to do this. You choose to react the way you're reacting. You can either react, it is what it is, and move forward, or you can get angry about it, you know, and you're choosing to react the way you're reacting to the situation, and also to create a meaningful experience and existence. You know, and jobs can be very difficult because people can struggle with not feeling like they're meaningful in their job. The assessment in existential psychotherapy emphasizes an understanding of the subjective world of the patient rather than a traditional assessment procedure and diagnostic constructs. Values and assumptions about the world are examined. The psychotherapist is generally not concerned with the patient's past. Instead, the emphasis is on the choices to be made in the present and the future. So very different than psychodynamic therapy, where we're focusing on the past. And the first session is extremely important for building an authentic therapeutic relationship. I would say that's with every therapy. You know, it's important to build that therapeutic relationship with the patient. And it's important for the therapist to attempt to understand the patient's current life situation, freedom of choice, potential for meaningful change, and expectations for therapy. What do you want out of this? So these psychotherapy techniques are interesting because it is philosophical, and they may bring up religion, they may bring up spirituality, they may bring up things that they believe, and it is an interesting therapy technique because it can get pretty deep with the patients to really understand where they are and how they are. So really helping the patient kind of question reality, and help them grapple with the complexities of the human condition and the given, you know, existence. Why are we here? This therapy works great for people who are questioning, why am I here? What is my purpose? So questions to encourage reflection include, What is the purpose of your life? You know, people really struggle with that. What is the source of meaning for you? You want to live an authentic life, let you stay in a relationship and job that give you little satisfaction. And how are you keeping yourself stuck? So that's important, because they have the freedom of choice, like was discussed before, but you're choosing this. So let's clarify this. Are you happy, or do you want to move forward? And what might be accomplished in treatment that would help you live a more authentic life? So emotion focused therapy, center role of emotion in psychotherapy. So it integrates person-centered therapy, gestalt therapy, and neuroscience of emotions. So you need to feel to heal. So I feel, therefore I am, our mantra is frequently touted in emotion-focused therapy. You need to feel to heal. Allow yourself to feel the emotion, and there's no wrong emotion, because some people, I feel bad that I have that emotion. There's no wrong emotion. And I feel, therefore I am. Key concepts in this therapy: an affective state that informs a person of important needs and prepares the self for action. So when you have an emotion, kind of evaluate it. Emotion schemes, complex memory networks within the amygdala within that emotion center, a neocortex pathway formed in response to emotional life experiences. These are the basis of adult emotional responses. And so those emotional reactions can be neuronically connected, kind of like in panic disorders within the amygdala. And then memory consolidation and memory reconsolidation, disrupting that previous memory and reconsolidating it to have a different emotion attached to it. So primary emotions, genuine, authentic emotion reactions initially activated in response to a situation, may be adaptive or maladaptive. So looking at what's adaptive and maladaptive in terms of the responses, and helping them relearn those emotions. So secondary emotions, emotional reaction to a primary emotion or thought that follow, replace, or obscure a primary emotion, like feeling guilty about feeling angry, or feeling angry in response to feeling hurt. So really, why am I feeling this way? How do I feel this way? Really understanding why you feel a certain way. And then I like how it says patients learn how to access primary adaptive emotions and transform primary maladaptive emotions. So really understanding where that came from and reprocessing it and saying this is a more appropriate way to move forward with that emotion. And the use of secondary and instrumental emotions is decreased so that the patient are not being encumbered by them. The first phase of therapy is bonding and awareness phase and continues throughout the process. Emotional awareness, emotional regulation skills, and emotional schemes. So really helping the patient through that. Just in terms of emotion-focused therapy, in terms of our medication management appointments, just being aware that patients may have these secondary emotions on top of their primary emotions, which may be maladaptive for them, and helping them feeling how they feel and understanding how they feel. And then the second phase of EFT is called evoking and the exploring phase. And so again, we're not really going to be able to do all of this psychotherapy in medication management appointments, but being aware of the language for it, and if you can refer somebody for emotion-focused therapy, knowing how to explain it to the patient. And then here are some examples of in-session markers and interventions that can be done in therapy. So you can pause and read that. Some other examples of in-session markers and interventions, and you can pause and read that. And some more kind of session markers and interventions that you can read and go through. So the third phase of EFT is generating new emotions and creating a new narrative to that. So really helping them understand their emotion and a more adaptive emotion process. Solution-focused therapy, you definitely can use solution-focused therapy in a medication management appointment. I am very solution-focused. If there's a problem, I want to solve it. And I would say I probably utilize solution-focused therapy and cognitive behavioral therapy and motivational interviewing quite a bit because it leads to a change. You know, people can have a problem. I struggle with just listening to the problem without having an answer to the problem. I think that's just how I grew up, and that's just how I am. So solution-focused therapy is a brief psychotherapy. Smaller changes lead to bigger changes, and the effects of change tend to multiply. Solution-focused therapy argues that a problem-focused approach using problem talk actually helps maintain the problem, but that a solution-focused approach using solution talk helps the patient change in a positive direction. So I struggle with, and I'm fully aware of this, and this is why I communicate with therapists and communicate with coworkers. I struggle with woe's me. When people are stuck in the woe's me and they have problem talk, and, you know, this is a problem, that's a problem, that's a problem. Everything's woe's me, and they don't want to move forward. They're just stuck in the woe's me. And I get irritated by that because I can offer, you know, in terms of, well, let's look at this in a different lens. And then it just continues to be woe's me. Then to me, it's like the patient doesn't want to get better. So I struggle with that. And so I give therapists all the credit in the world for being able to listen to that because sometimes patients just need to vent, and I'm much more solution focused. So solution focus is identifying what's desired, you know, and I'll ask them, well, what do you want to come of this? And, you know, I don't know, they're stuck in the woes. The therapist invites the patient to construct a concrete vision for a preferred future. So solution-focused therapy helps the patient change by constructing solutions to the problems rather than dwelling on them. That's why I work really well with this type of therapy. The two key therapeutic goals are to determine how the patient wants his or her life to be different and what will it take it to make it happen. And creating a detailed picture of what it would be like in the future when things change creates a feeling of hope and makes the solution seem possible to the patient. And so within this, you know, you're creating this very positive climate. You know, how can we change this? The focus is on desirable behaviors like I will rather than I will not, and as concrete, specific, and behavioral. And with solution-focused therapy, you know, the diagnosis is kind of irrelevant because you're really just taking a problem and moving with it. And so solution-focused therapy tends to be pretty brief because you take a problem and you solve it. Within solution-focused therapy, what you need to take out of this is solution-focused therapy asks the miracle question. Help the patient identify a goal and envision the future without the problem. So the miracle question, solution-focused therapy, be aware of that. So like a miracle question would be, suppose that one night there is a miracle and the problem that brought you to therapy is solved. How would you know? So that would be the miracle question. You know, what would this look like when this was all done and over with? What would you like this to look like? How do you think this would be? So then you have joining questions. The therapist connects and accommodates to the patient's world. What needs to happen today so that when you leave, you'll think this was a good session? And then pre-session change questions between now and when we meet. Think about what the perfect therapist would do. Very specific questions that you can ask within solution-focused therapy. But miracle question, that's all about solution-focused therapy. What would this look like if this was gone? And then some other questions that you can utilize in solution-focused therapy is exception questions. When was a time that a problem could have occurred but didn't? Was there ever a time when you felt happy in your relationship? And then scaling questions, rated on a scale of 1 to 10. I do that with depression and anxiety. I utilize a lot of scaling questions. And then we have coping questions, and then we have compliments. I definitely, when people have done their homework and they've progressed to solve the problem, like the person that came in crisis because of work had a job interview, and I was like, congratulations, like this is great, you're seeking a solution for the problem that you have, because we can't be continuing in this problem. You can choose to live in the problem and accept it, but it doesn't look like you're accepting it. But now it looks like you're trying to change it and move towards a solution by getting a job interview. So techniques in solution-focused therapy, experiments or homework assignments are suggested by the therapist for the patient to try between sessions. At the start of each new session, the therapist will ask about what learning has occurred since the last session and review experiments and homework assignments. So it's some type of homework that you might do in solution-focused therapy, and I've used this within medication management. Let yourself envision that when you leave the office today, you will feel more competent. What will you be doing different? Try that during the week. Try that during the week. And between sessions, the patient records anytime she feels competent and then notices what she's thinking and doing. So really offering them, ideas to be more mindful. So being mindful of what's going on and being aware of what's going on to help reach that solution. And then there's evidence-based research within all the different therapies, and you can read that. And then more certifications that you can do. So a lot of these therapies do require you to be certified in them. And some people don't do certain therapies because it requires so much certification. But if you feel like you want to learn more about the therapies, and again, most organizations want us to do medication management because the therapists are paid to do therapy. They have the time to do therapy. We're paid to do medicine. That's our role, is medicine in most organizations. But we are nursing too, to be there for the patient, to help them walk through life. So we're there to be there for them. And like some of the graphics in other chapters, we have ourself, and then we have that relationship, and then we have medicine. And that's the difference between us as psych NPs compared to medical doctors, is they're more focused on that medicine, and that relationship circumvents that. And we really build on our relationship and then supplement with medicine. So if you want to learn more, definitely look into the different certification programs that can be out there.